हेलो फ्रेंड्स, आज पढ़ते हैं गैंग्लियन। कैसे डिफाइन करेंगे गैंग्लियन को? गैंग्लियन कैन बी डिफाइंड एज अ टेंस cystic swelling which occurs in relation to joint capsule and contains gelatinous material in it. Obviously, it is occurring at the joint. So, wrist joint and the finger joint, it can be present. Or you can also define it as this is a cystic swelling caused by mucoid or myxomatous degeneration of the connective tissue of the joint capsule or the tendon sheath. Before starting the lecture, let us see the video. I have made this swelling taut by flexing the wrist joint so as to fix it. Okay, now first what we are doing is we are aspirating the ganglion. You can see this is the myxomatous degenerated tissue or gelatinous material which is coming into the syringe. It is being aspirated and till the swelling maybe subsides. You can see this. Initially the swelling was big and now it has reduced to a size. We'll aspirate till nothing comes, and now we have almost fully aspirated it. What we'll do is now we'll inject the triamcinolone and we'll try to inject the full 1 ml amount which is there in the vial. The pathogenesis of ganglion is cystic degeneration of tendon sheath, which leads to synovial fluid leakage into the joint capsule, which lead to small islands of microspaces, which again fuse to form a ganglion, which looks like the swelling in the picture. The locations are, the most common is dorsum of the wrist, the second is flexor aspect of the wrist, ankle joint, and at the base of the finger. When it is at the base of the finger, it is called seed ganglion. You should remember this, maybe a MCQ. The clinical feature of a ganglion is or are, it is smooth, well demarcated swelling which is soft or tense, maybe, which is mobile but mobility restricted if tendon is made taut. Non-tender, usually it is non-tender because it is non-infected, maybe transilluminant also. Pain can also be a symptom which requires intervention. Obviously, if there is pain, you require to intervene in this. Paget test is positive, you should remember. The diagnosis can be, the other diagnosis can be a lipoma or a lymph cyst or a sebaceous cyst or a sesamoid bone or exostosis, and it can be a bursa also. The treatment of ganglion is, historically what they used to do is they rupture the ganglion cyst by Bible book, and it used to rupture, ganglion disappeared, again to repair maybe. If asymptomatic, it can be left. Aspiration can be tried, but it has high recurrence rate. The other method is aspiration followed by steroid injection. It also has a high recurrence. Other method is excision. This is also having a high recurrence. There is a term, compound palmar ganglion. You should know this. It is chronic inflammation of the common sheath of the flexor tendon leading to swelling of this sheath, that is ulnar bursa, above and below the flexor retinaculum. So you may be able to feel the two swellings which are interconnected, and if you press one swelling, it may be transfluctuant, like if you press one swelling, other may be becoming distended depending on the pressing. The causes can be tuberculosis or rheumatoid arthritis. The patient presents with the swelling mostly without pain in the distal part of the volar aspect of the wrist, which communicates with the other swelling in the palm. The swelling shows cross fluctuation above and below the flexor retinaculum because the swellings are interconnected. The paresthesia due to median nerve compression may occur. The treatment is surgical excision with division of the flexor retinaculum. Thank you so much.